So it's 2 a.m. and a child presents with otalgia from an acute otitis media and is crying despite full doses of paracetamol and ibuprofen. Any suggestions? Hello and welcome to this week's Urgent Bite, brought to you by the Royal New Zealand College of Urgent Care. My name is Guy Melrose, and today I ask Director of Clinical Training Dr David Sorrell about a way to settle the pain from acute otitis media. Okay, so I am joined once again by our Director of Clinical Training, Dr David Sorrell. Morning, Dave. How are you?
Good morning. I'm fine, thank you.
Now, I've got you on the line, Dave, just to briefly discuss something that I came across the other day when browsing through the Royal Children's Hospital of Melbourne acute otitis media guidelines that are available on their website and which are linked in the show notes. And we all know about the significant pain that a good otitis media can cause a child, and I think we've covered before how antibiotics, when they are indicated and when they're not, and all that side of things. But this little one-liner in the treatment drew my attention. It says, as an adjunct, short-term use of topical 2% lignocaine, 1 to 2 drops applied to an intact tympanic membrane, may be effective for management of severe acute ear pain. Now, this isn't something that I've personally used before, so I was interested in your take on this as a treatment for ear pain associated with otitis media.
Great. Yeah, so my experience is slightly varied to this. So yes, I have used topical lignocaine for ear pain, but in actual fact, I've not used it for this particular indication. So there's two circumstances where I have used it. So the first is in a situation where a young child was prescribed Vosol or acetic acid drops, which produced intense, severe burning pain in the child's ear, and the child was extremely distressed. I had not prescribed this in a young child, and I don't prescribe Vosol ear drops in anyone under 3, maybe even under 5, because of that experience. And in that situation, I put a few drops of lignocaine in. So I got the IV 1% lignocaine and put several drops into the ear and then let it soak around the ear for a minute and then run out. And it produced a very rapid pain relief. The second instance, which I don't know if you've heard of this before, but if someone has an insect stuck in their ear that's buzzing around and causing it incredibly intense discomfort, I use lignocaine drops because they provide a cardiac arrest for the insect in the ear, and then there also means that it's water soluble. So if you wanted to sort of gently wash the insect out again, that's okay. Now they do talk about using mineral oil for this, but then the mineral oil is stuck and so is the insect in the ear. So the situation, of course, is for acute severe otitis media. I had a chat to a pharmacist before, and they said, well, look, we can't make this up. We don't know anything about stability. It doesn't come in an eardrop form. And we're going to link in the show notes to a very good review of the article that talks about lignocaine for otitis media. So this is not for home use. It's for single use in the clinic. And my suggestion is if the child between the ages of 3 and infinity has acute severe pain in the ear from otitis media usually, then you can use drops of the IV 1% or subcut 1% lignocaine solutions to ease the pain, but you shouldn't be giving them the analgesic to take home. And where I work, we don't have the plastic ampoules, we only have the glass ampoules, and it would certainly be inappropriate to provide glass ampoules to parents to take home to put drops in their child's ear. Lignocaine aqueous does seem to be relatively safe in a ruptured eardrum, but ideally you would use it only in the situation of an intact drum with severe otitis media. The other preparation that you can get from the chemist is called Oralgan or Oralgan, which I have seen being prescribed in the past, and that's a benzocaine preparation. And of course, that is an over-the-counter medication that's pharmacist only, so it does cost about $12.99 from Chemist Warehouse near you. It may be more expensive in other chemists, and it again can only be used with an intact tympanic membrane. So it would be something that you can use as well as the oral analgesia for severe otitis media pain, but it's not something that you would be prescribing or having the patient take home with them.
So quite a good thing to use for that very uncomfortable kid that's brought in at 2:00 in the morning to get rapidly on top of the pain relief until the oral ibuprofen, paracetamol, etc. gets on top of the pain, and then the parent and child goes home happy from the clinic, but without a take home of that. So just as you suggested, that single in clinic use. And this was obviously for kids, but I imagine we obviously have guidelines of when to give antibiotics, and the younger the child, the more likely antibiotics are to be prescribed, although we're still encouraged to try not to. But as kids get older and into adolescence and adults, I would imagine using topical lignocaine would be a good adjunct for adults and adolescents as well. Would you think that too?
Yeah, and I think in particular when you've got the instance of the adolescent child or whatever, and they come in and they've had the Panadol and they've had the ibuprofen, and obviously, isn't there something you can do, doctor? And I guess that means, well, there is something I could do. I could put some local anesthetic drops and let those soak in for a minute or so, and then at least you can have the discussion about, look, it's just an acute pain, and antibiotics are unlikely to do much for this. So here is a prescription for antibiotics for if the ear pain is still there in another couple of days. But I suggest if the pain goes away, you don't need these medicines. And then you've done something, you've given something, and so you may have a happier parent, hopefully.
Yeah, addressing their main cause of concern is the pain, and I guess
yes.
Patients associate antibiotics with removing pain. Well, that's not necessarily the case. So it was an interesting thing. I'd encourage everybody to read the Royal Children's Hospital guidelines, which we'll link to, and the paper that you alluded to, Dave, that priority updates from research literature, PURLS, or PEARLS, from the Family Physician Inquiries Network, goes through all the different options and is a useful read. So thank you for discussing this with me today, Dave. I appreciate your input as always.
No problems. My pleasure.
My thanks to Dave for talking to the podcast. As we mentioned, check out the show notes for links to the Royal Children's Hospital of Melbourne guidelines, as well as the article that Dave mentioned. Both are well worth a read. Now, I'd be interested in your feedback. Do any of you use lignocaine in your practice for acute otitis media? And if so, have you had good results with it? I would particularly like to know if any of you have had any negative outcomes, and have any of you used the Oralgan over-the-counter preparation that Dave mentioned? Please let us know via podcast@rnzcuc.org.nz. Now we'll be back again next week with another podcast. I look forward to seeing you all then, but for now, thanks for listening.